But first, your medical minute. Winter means the opportunity to get outside and enjoy those seasonal sports, but they can lead to injury. Saltzer Health orthopedic surgeon Dr. Chlebeck explains how we can all prevent winter sports injuries. It is winter season, there's snow on the mountains, we really want to go out and play, but help us understand though, what are the most common winter sport injuries?
So the most common winter sport injuries are distal radius fractures, which is a break of the end of the forearm bone, things like an ACL tear, but more commonly sprains and strains, and then concussions as well.
Okay, tell us about the distal radial fracture of the arm and also those ACL injuries. How common are they though?
Yep, so neither of them are very common. We're thinking less than 1 per every 1,000 people on the slopes, but they do happen, and so there's things we think about to try and prevent those.
Okay, and how do we prevent them?
For snowboarders, things like learning how to fall and keeping your hands protected. We get in shape, so being in better physical shape and preparing for the season is helpful. Wrist guards, helmets, protective equipment, and things like that are helpful.
Okay, I like how you mentioned preparing before you go out. So don't just go from the couch and then go skiing with the family. Make sure that maybe you've done a little of activity before so you can control yourself better when you're going down that hill, right?
Absolutely. Most winter sports use different muscle groups, and so getting in shape ahead of time is huge.
Okay, and let's talk about concussion though, because we hear a lot about that, especially when it comes to skiers.
Absolutely. They've become more and more prevalent, partly because we're recognizing that they happen more often and the signs and symptoms are subtle. So the biggest thing for concussions is really prevention, and that comes down to wearing a helmet. They're so accessible, they're not hot and sweaty, they've got vents, and they're easy to find these days, so everyone should wear a helmet skiing and snowboarding.
And how do we prevent the ACL injuries?
ACL injuries are a little bit harder, but mostly being in good physical shape, wearing skis with releasing bindings, and learning how to fall. And when you get tired at the end of the day, end your day. Don't take that one last run when you know you're tired and bad things can happen.
Okay, so know when to call it quits.
Absolutely.
You can always come back for another day.
Definitely.
Okay, if somebody's out though, they're on the mountain, they're skiing or they're out there ice skating, and they think they have an injury, what should they do?
So stay put, ask somebody for help. There's ski patrol on the mountain that can help get you down to the bottom. And once you get yourself to the bottom, there's plenty of places in town to be evaluated, whether that's the emergency department, one of our urgent cares, or even orthopedic specific urgent cares.
Thank you so much.